The Supreme Court struck down the part of the law which enabled the government to force states to expand Medicaid, which meant states could choose to reject the expansion, even though that would be an odd decision. Under the law, the federal government would pay 100% of the costs for the first 3 years, eventually decreasing to 90%. And I can't think of anything I would not buy if I only had to pay 10% of the price. Fred Claus on DVD? I mean, no thank you, but yes, I'll take it. Vince Vaughn is always good for 49 cents worth of yucks. Basically, for relatively little of their own money, states could cover all their poorest citizens. It was an exceptionally favourable deal. But guess what many states chose to do?
Texas will not be participating in Medicaid expansion.
They're working hard to change the American dream into the European nightmare.
This system we call Obamacare that we now see is going to be a train wreck, and I do not want the name of Mississippi emblazoned across that train when it leaves the tracks.
Would you consider expanding a broken system? Of course not. Of course not. It's like a drug dealer. You give them your first hit free, and then they're hooked for years and years.
Yeah, except in this instance, that drug addict has cancer, the drug being pushed is chemo, and the corner boys have 7 years of med school. 20 states have so far declined to expand Medicaid, leaving over 3 million people in the Medicaid gap. People in the illogical situation of not making enough money to receive government assistance. Just listen to LaShawn Horde, a diabetic who at one point was forced to reuse needles to save money.
I don't make enough money to get the insurance through the federal government, and then I make too much to get Medicaid. And I cannot afford the insurance that's offered at my job. So I'm just hanging in the air. It's hard to explain how disappointing it is.
Okay, the word disappointing does not quite cover it. Disappointing is your child dropping out of college to be a street mime. Gerald, your mother's devastated. Do not pretend you can't hear me inside that glass box. I know you can hear me, Gerald. This kind of situation is not disappointing, it's tragic. The frequent argument for states refusing the expansion is they couldn't bear the increased cost. Although it is worth noting that, to their credit, even fiscally conservative Republican governors like Jan Brewer, Chris Christie, Mike Pence and John Kasich did expand Medicaid in their states, despite being firm opponents of Obamacare.
I don't support Obamacare. I want to repeal it, but I did expand Medicaid because I was able to bring Ohio money back home to treat the mentally ill, the drug addicted, and to help the working poor get health care. Because you oppose Obamacare doesn't mean when you have an opportunity to bring these $14 billion of Ohio money back to Ohio, that's not Obamacare, that's Medicaid.
You know what? Good for him. Good for him, although it's a bit weird when accepting billions of dollars to give health care to poor people is somehow a brave and noble stand. When all Kasich technically did was see a dump truck full of money backing into his driveway and just not say stop.
I kind of have a tough time agreeing with that, because I don't think healthcare is a house or a car or a boat. You know, you're talking about people's life, and we should all have access to care, all right?
Hold on now, but wait a minute, my friend, who's supposed to pay for it, though?
It's not our job to protect people from outcomes. It's not our job to determine whether this is right or wrong or any of that.
Do you have any idea what this is going to cost you? You haven't any idea. All you think is that it's a good thing because Obama wanted it. Well, let me tell you something else. Your life is over as you know it. America is over as you know it.
Love Obamacare or hate Obamacare, it does mean that more people in our country have health insurance now. The verdict is in. There is an exception, though. It is the state of Mississippi.
The healthcare system right now is a very scary situation. We're potentially at a point in Mississippi where if Mississippi don't make the right decision, that we could possibly see our healthcare system crumble down around us.
My name is Tamika. I'm 31 years old. Now I'm just getting back into the workforce where I can work with my passion, that's cooking, being in the kitchen. And now I'm currently employed at the Cilantro's Mexican Grill on the Kent Square. I'm a mother of 4. I have 3 boys and 1 girl. I'm a licensed minister at Turning Point Fellowship Ministries International, located here in Canton. Now I'm working. My job doesn't provide insurance. I remember going to go get registered for school. And you know how girls just kind of like to touch their face or whatever. And I was touching my face, touching my neck, and felt this big old lump in my neck. And I was like, Mom, you know, what is this? I didn't know what it was. I was told after my surgery that they not only removed the goiter, but they found cancer. My thyroid was laced with cancer. That was the beginning of my journey with thyroid issues. I now have hypothyroidism, where it makes me sluggish and sleepy if I'm not on my meds, if my meds aren't regulated. I've been going through a struggle right now. When I've been off my meds for a long period of time. There came a point in time where I decided, well, I'm not just gonna sit up and let the government take care of me. I'm gonna go to work. And sometimes I say, why did I do that? Because I was no longer able to get Medicaid.
I was excited when I got information from Tamika. I had really started pushing at that point to capture as many uninsured people as we possibly could.
And she tried her best to get me on insurance with the Obamacare.
I was so excited because we were talking, and she told me she was working, and I was like, great, okay, what's your income? And my jaw kind of dropped, and I was like, oh, you know.
My income just wasn't enough. She tried all kinds of loopholes, avenues, asking people, well, what can she do?
She looked at me like, what are you talking about? And that's when I had to explain to her how things work here in our state.
Right now we have roughly about 140,000 Mississippians now who could possibly be put on Medicaid through the Medicaid expansion, that right now they have no form of health insurance at all.
The Affordable Care Act hoped to cover more poor Americans by requiring states to expand Medicaid, but 26 states declined to go to that expense, creating a coverage gap.
As an organization that has done direct enrollment, we've seen numerous cases of people coming in only to find out at their moment that the reason that they are not eligible for any health care is because our state didn't expand Medicaid. In each one of these cases, these have been people that go to work every day and they just happen to fall in the unfortunate lot of not being able to afford health care.
The coverage.
When I read that article where the governor had talked about community health centers being the answer for access to care, in one small component, I absolutely agree with him. But healthcare centers, community healthcare centers, we're not the only answer. We serve the primary healthcare needs. We don't perform home health. We don't have hospice. We don't do inpatient care. We don't do long-term behavioral health by and large. You may see some pockets of that throughout the state, but they're not enough to meet the need, nor are they on a large scale sustainable. we continue to see a large number of folks who come in for episodic care because they yet do not have access to insurance coverage, which would provide them that access that they could afford.
God forbid I get sick, you know. I wouldn't be able to go to work and I wouldn't be able to go to the doctor without having an enormous medical bill from the hospital. Whenever I have a doctor's appointment to come up, just put back at least enough to get in the door to see the doctor. And if I have to hold on to prescriptions, you know, for weeks at a time when I need them right then until I can get money to pay for them. And that's what I have to do.
If they had the health insurance that they need, then they would not have to worry about, you know, paying the rent versus coming in and getting their high blood pressure checked and getting their high blood pressure prescription to keep that controlled so they can continue to have, you know, a job and a meaningful career. What you're talking about is an opportunity to dramatically change, you know, people's access to care.
It is the terminal consequences of a disease that is so expensive and it is swamping the state of Mississippi. Frankly, I've been very disappointed in my world, the world that I dwell in, and that the healthcare community has not been more outspoken on this. And the fact of the matter is, I think that they were trying to be respectful of our State House leadership, which I think has been very wrong-headed about this. And I think history will describe this as a major misstep.
Have you heard from hospitals? I've heard the Hospital Association wants to see an expansion because they're going to lose money under this new formula.
You know, I've talked to
Obamacare.
some of them, and what they're concerned about is what's called the dish payment, the disproportionate share. If that's restored, which I think it will be, I believe the hospitals will be fine. I don't think the federal government is going to do away with the dish payments.
We are currently experiencing troubling issues around our rural hospitals. There's a program called the DISH program, and this stands for Disproportionate Share Hospitals. These hospitals are those that receive federal payments because they service a really high population of medical and uninsured people. In the Affordable Care Act, the way the law was written was because Medicaid was going to be mandatory for the states, the federal government was going to decrease those payments because you would have more people covered under Medicaid. So, when you have more people covered, there would be no need for as many federal dollars going to these hospitals. Over the course of a few years, the idea was that the payments would be phased out. So, when you have non-expansion states like Mississippi, you still have the problem of the DISH payments also being phased out, and the number of uninsured people still coming to these facilities. So you're losing money from the DISH payments, and you're still losing money from providing care for the uninsured Mississippians. So as a result, you have hospitals trying to adapt this new reality to healthcare, where these DISH payments are being phased out, and they are still seeing uninsured patients, all while having to figure out how to make the bottom line. And in some cases, this may mean hospitals having to change services, eliminate services, or in some extreme cases, even having to close.
Why do you remain so convinced, sir, that Obamacare, that the health care law is going to do more harm than good in your state of Mississippi?
Well, you see recently what's happened just this week. The Obamacare administration has basically said they're going to delay Obamacare. But he's asking us in Mississippi to say, we believe that you're going to provide billions of dollars, or roughly $11 billion between now and 2020 to the state of Mississippi, so it won't cost us anything. It's that free money from Washington. We just don't feel comfortable with that.
You know, the state of Mississippi has turned down about $1 billion a year to expand Medicaid in the state. The governor and the legislature believes it would increase the cost of the state of Mississippi. I do not manage Medicaid. That's an issue that falls under the purview of the governor and the legislature, and they're the ones that have to choose if they want to expand Medicaid. So it's a very controversial issue. It becomes one of ideology. It's not one about whether someone actually needs help. It's one about whether we think they ought to get help or not. I say we, I should say whether the governor and the legislature think that.
The first 3 years of the Medicaid expansion is not going to cost, or wouldn't have cost the state one dime. When you look at Mississippi, Mississippi is the poorest state, we're the unhealthiest state, we have the highest rate of mortality, we have the highest rate of death as it relates to breast cancer, even though we have the lowest occurrence of it, which basically shows me or tells me that there's a lack of health care here in the state of Mississippi.
Medical debt is the leading cause of bankruptcy in the U.S. Tonight, we begin a new series, Your Money, Your Health. Here's Maria Villarreal.
Michelle Mills remembers the day she rushed her son Blake to the hospital after he broke his nose.
On the way, I called admissions. I said, are y'all still in network with First Health? They said, yes, we are. And I thought, okay, I'm on my way.
The Jackson area hospital was in network, but the emergency room care was not. 4 months later, that cost Mills an additional $1,800.
When you opened this bill, what was your first reaction? Oh, crap, I've got to pay that.
Nearly 65% of hospitals across the country use emergency rooms staffed by outside companies. It's a loophole that allows providers to charge patients more because the ERs are considered out of network. But it's illegal in Mississippi thanks to a 2013 state law Representative Gary Chisholm helped pass. The problem, there's no power to enforce it.
There's no teeth behind that bill, and we need to rectify that and put someone in charge.
Chisholm says a move to fix that has stalled.
This is an election year, and there was some concern that this might not be the best year to do it.
Roy Mitchell is the director of Mississippi's Health Advocacy program.
We're not asking for any new legal protections. We're just asking that the law be enforced and that illegal activity by providers stop.
Mills did get her bill reduced to $285, but she's worried about those who could be taken advantage of.
I think about older people or people who have not experienced anything like this. They're going to feel like they're obligated to that. You know, pay that they, particularly if you're honest.
An extra cost many can ill afford to pay. Mireya Villarreal, CBS News, Jackson, Mississippi.
A special report. While Republicans failed to repeal Obamacare this week, they have done something else that might be very important. We've obtained new evidence on efforts to undermine Obamacare from within Trump's HHS department. We learned about this on The Beat from Roy Mitchell, who runs a healthcare program in Mississippi that works with people to get them enrolled in the ACA. Now, he had major plans to do that with the Trump administration, even meeting with the regional HHS director and setting up events for them to attend, until he received this new email that says that they're pulling out of marketplace efforts in the regions, that HHS offers apologies for taking so long to announce this cancellation. Mitchell is now blowing the lid off this, releasing this email and saying it shows an effort to sabotage Obamacare in the field after Republicans failed to repeal it in D.C. And there's evidence for that. The administration has already slashed advertising by 90%, cut funding for the people who guide consumers to these plans, and cut the time available for Americans to choose plans in open enrollment by 50%. Now, we asked the Trump administration about all this tonight, and they didn't detail whether or not they're canceling events across the rest of the country. An HHS spokesperson gave a response that sounds a lot more political than policy focused, telling us, quote, the American people know a bad deal when they see one, and predicting that people will not sign up for Washington knows best health coverage that they can't afford, and asserting that, quote, Obamacare continues to collapse. With me now is that man, Roy Mitchell, executive director of Mississippi's Health Advocacy program. He's been working with the Department of Health and Human Services since 2013 to get people signed up for Obamacare. Tell me what happened and what you think this means the Trump HHS is doing.
Sure, Ari. This was essentially the most minimal effort they could make in Mississippi, attending meetings convened by nonprofits to get the word out about the ACA enrollment period. And as you know, the enrollment period has been shortened, cut in half. The funding for advertising is cut 90%. navigators are reeling. Their budget's been cut by approximately 60%. So this was the least they could do, is go out with us throughout the various regions of Mississippi and explain what ACA enrollment was going to look like this year.
This all comes on the same day that Tom Price is apologizing for all of his money spent on private jets. How do you contrast that with what you were told by HHS?
It's hard for me to fathom. We could have certainly used $400,000 for outreach and enrollment in Mississippi. We sorely need that. Mississippi has the highest uninsured rate in the country, or close to it. We have a low per capita income. So we have a lot of uninsured people that need health care for not only their health security, but their economic security as well.
Sure. Roy, stay with me. I also want to bring in Maya Wiley. She's a counsel to New York City Mayor Bill de Blasio previously. Maya, you look at this, Roy was saying this is the law of the land. What does it tell you, and what is the concern if the administration's lost the Senate vote to try to, okay, fix it, change it, whatever their view is, and now they're doing this?
If you want to kill a program that's working, starve it. And that's really what this is. It's an attempt to make a prediction, as you read in terms of the Trump administration's response here, a prediction that enrollment will be down by actually suffocating enrollment, by starving the ability to get enrollment numbers up. It's cynical. It's going to cause, it's actually a life and death issue for some of our people in this country, and it's cynical and it's shameful.
I want to play Donald Trump talking about Obamacare, Roy, because this is a tough policy, complex problem. And a lot of folks have looked at ways to change or improve healthcare policy, even with some of the changes that have been made. But what we're seeing, and why it's so interesting that you were willing to disclose or blow the whistle on the email you got, is this isn't about what's naturally happening. This is, as you both just mentioned, active efforts to create a reality. Here's Donald Trump. Take a listen to him on Obamacare.
Obamacare is a disaster. It's failing badly. You look at the rates, you look at what's happening with premiums for people that can't afford Obamacare. It's been a catastrophic situation. Obamacare is a disaster. It's a wreck. It's a train wreck, and it's only getting worse.
So, Roy, the question for you is, with your dealings with HHS now, do you think that what he's saying is what they're actually trying to achieve, to engineer?
Well, I'm very concerned. I'm wondering what's next, Ari. What kind of sabotage could we see in healthcare.gov?
Mm-hmm.
Here's the thing. It's very hard for me not to laugh when I hear those statements, because we literally have the lowest uninsurance rates that we've had in this country since 1960 as a result of the reforms that were made in 2010. Now, that's not to say that there aren't ways to improve the program. One improvement would be, for instance, all the governors that have refused to expand Medicaid insurance for all the residents of their states that can't afford coverage would be one of the ways. California actually cut their uninsurance rates in half between 2014 and 2017. That's a success that we should build on. We even have new research that shows that people's medical debt is lower, and they're getting screened earlier, which means lower mortality, less illness, and frankly, lower costs. But I think the primary issue here is a moral one, which is we have people who are healthier as a result of this program.
Right, and that's the human scale. And the question is, what are the pressure points on the administration, particularly if people like Roy Mitchell, who's been out there doing this work, not in the media, not talking, you've been out doing it, and you're sharing with us some of what you're finding, what you're learning. So I appreciate you enhancing our journalism in that respect. We've learned a lot from you and what's going on down there. Roy Mitchell and Maya Wiley, thank you both.